Hi, I'm Dr. Aliabadi. If you struggle with irregular cycles, acne, facial hair, body hair, hair loss, or insulin resistance, you might be dealing with PCOS, or polycystic ovarian syndrome. Having dedicated my life to helping women with PCOS, I understand the challenges in getting an accurate diagnosis and the right care. That's why I created Ovi, a science-backed alternative to prescription medications. Ovi is designed to help you take control of your health with clinically proven, validated ingredients in a simple, once-a-day solution. For too long, women with PCOS have had to choose between lifelong prescriptions or complicated supplement regimens. Ovi offers a better way to help manage your symptoms without the hassle. It's my mission to empower women facing PCOS and other hormonal issues by providing the information and support they need. Reclaim your health once and for all. Go to ovi.com. That's OVII.com and start today.
May is Preeclampsia Awareness Month, and this week on SheMD, we're relaunching our 2024 interview with Sofia Grange, where she shares her frightening experience with postpartum preeclampsia, along with impactful guidance from Dr. A, who had been Sofia's OBGYN since she was 15 and delivered Sofia's daughter Eloise. In raising awareness about preeclampsia, we can help save lives and ensure that mothers and babies have the best possible outcomes. If you're a longtime listener of SheMD, you know that changing health outcomes for women is one of our primary goals. You can learn more by going to preeclampsia.org. Now here's our conversation with Sofia Grange. Sofia, we are so honored to have you on our podcast. And Dr. A has told me so much about you. She says you're one of her daughters. That's how she describes you.
Yes.
I love you for saying
She's
that.
been with me for so long. When she gave birth, I thought my daughter was giving birth.
She literally told me that.
I've been seeing Dr. A since I'm 15 years old. She was the first OB I ever went to.
Oh my God, you're so lucky.
I know.
That's incredible.
I really am so lucky. I love you so much.
Oh, I love you.
So how did you, was there a family friend that had gone to her? Like, how did that happen?
My dad actually, at the time when you're a kid, your parents, refer everything to you. So my dad was like, I did some research and the best person in the business is this doctor named Dr. Thaïs Aliabadi.
First of all, can we just take a minute to talk about the fact that your dad, for all of you that have been living under a rock, her dad is Lionel Richie, who everybody says he's the most incredible human as well as musician.
He's a great guy. He's a great guy. But one thing that him and I have in common is he is the biggest hypochondriac. So when it comes to medical, him and I are like bouncing off like, who's the best? Who's the best? So I trust his opinion, and thank God I did, because you're the best.
Oh, I love you.
And so can we talk about first of all, you just had a baby girl,
I did.
Eloise.
I did.
And you look insane.
Thank you so much.
Literally.
I really appreciate that. I'm 3.5 months postpartum, which is crazy that time has flown. I feel like it's just flying. She's like already sitting up and holding her head up.
She looks like she's 6 months old. She's
she's
advanced.
So she's doing great. And I was actually just telling you before we got on the podcast, I will take looking good at 3 months because of what I went through in my pregnancy.
So can we talk about that? I'd love to. You should be so open about.
Please, yeah.
So you were trying to get pregnant.
I was trying to get pregnant. Yep. My husband and I got married a little bit over a year ago, and after we.
By the way, the best wedding I've ever been to.
I saw it. Everybody saw it.
Now, can I just take a pause and
Okay.
say something? That wedding, and I've gone to a lot of weddings in my life, and it was the most romantic wedding I've ever been to. The entire weekend, you felt the love around you. I mean, if you know Sofia, you know that love comes out of her pores. Every time I get a text from her, it starts with, I love you, and it ends with, I love you. And that's how she is with everyone. If she does this to me, so imagine what she does to her relatives and her friends. So, and that summarized the weekend at her wedding. It was magical.
You know what? If you were the outside looking, you would think that was a gigantic, like big bash, not heartfelt wedding. But if you were there, it was 120 people. It was 90% family, 10% friends. And the only reason why it felt so shared was because I shared the photos after.
Right.
But if you were there, it was really like a family event. It was so
Romantic.
And it really was based around just love. My husband's dad is in the music business. So our dads have worked together for like 35 years and our brothers were friendly. So Elliot and my brother were set up by our dads because they're the same age. And when you're a kid, like your relative does not want you to hang out with them and their friends. Like it's not a thing.
The older brother, little sister.
The older brother, little sister. And then during COVID, I actually had a mutual friend introduce us. And we started going on these safe COVID walks together. And that's kind of how it all started. It really was based off of friendship. At the time, I just moved back into my dad's house in the beginning of COVID. And he was filming American Idol. So he was in like somewhat of a COVID bubble. My dad was okay with me seeing Elliot because he and his family had COVID. And so once I found out they were okay, my dad was like, you're more than welcome to go see them. So I walked with him. He was like my only friend in COVID that I could see.
So it was a COVID romance.
A COVID romance, literally.
That's so sweet.
I know.
And so y'all obviously fell in love. You had this beautiful wedding, and then you wanted to have babies right away.
I was on birth control for 10 years. So right after the wedding, I got off of birth control, and it took me about 6 months. But we were actively trying for 6 months, and which is such a crazy thing. Actively
By the way,
trying.
that's average.
Yeah.
That's
Okay.
very normal.
Okay.
Yeah.
I was lucky that we got pregnant that quickly. I really actually thought it was going to take longer. And
Was it an easy pregnancy?
It was until it wasn't. I'm actually really excited to be here with you guys today just because now that I have my child, I'm like, I feel like people really don't talk about all the things that go wrong and all the things after you give birth that are so hard. So I'm excited to be here to talk to you guys just kind of about that and make people feel less alone with that. Just because once I started reaching out to girlfriends being like, hey, this is my experience, the amount of, it was like 95% was like, oh, me too.
Yeah.
And I was like, why did I feel so alone with that until I actually had to like go and personally get information from people one-on-one. But yeah, I had a great pregnancy up until about 32 weeks. And I woke up one morning and I texted Dr. A and I was like, Dr. A can tell you she's not going to say it herself. I'll say it. I am probably one of her most neurotic patients.
I don't think that's true.
You have no idea what neurotic patient.
I'm sure. But I text her all day. I texted her every day. Thank you so much for not being annoyed with me. And I was just like, I'm feeling this. I'm feeling that. And at 32 weeks, I woke up and I was like, hey, I woke up and I'm really tired today. My back really hurts. I feel a little crampy. And I really thought it was going to be another one of those like, yeah, babe, that's pregnancy. Like, you're going to be fine, but you can come in if you want me to check you type situations. And she was like, you know what, actually, I think you should go see the fetal specialist to monitor to make sure that everything's okay. And then you'll go home. It's not a big deal. Thank God she said that because they hooked me up to the monitor and they were like, you're in active labor.
At 32 weeks.
At 32 weeks. So, I figured it's Dr. A. It's going to be fine. Like, she's just going to stop it. Like,
She's just going to stop it.
And she was like, no, you need to go to Cedars. You need to go to Cedars-Sinai, and we need to just monitor you and give you some IV fluids. So what was meant to be just like a few hours actually ended up being like a 6-night stay. Yeah.
And what was the reason for it? Like, what causes that to happen?
It could be multiple reasons. I mean, it could be trauma, it could be stress, it could be infection, it could be, and some people just go into preterm labor and we don't know why. So, every time patients come, we have certain things we can do to just, delay it as much as we can because you don't want to deliver a baby at 32
Were you
weeks.
terrified? I mean,
I was really terrified. Having Dr. A as a doctor is so assuring. I'm so lucky to have you.
Oh.
She not only comforted me, but my husband.
My God,
yeah. We had a great time in that hospital. She would come and she'd be like, hey guys.
but after six days, you got out.
After 6 days, I was begging. I was like, please let me go home. And she was like, you can go home, but you're on bed rest. We have to monitor you. So that's what I did. It was a kind of a waiting game from there. We were like...
And you're in bed rest after that.
Bed rest. But
Contracting.
yeah, contracting.
The whole time?
Pretty
Contracting.
much.
Yeah. And Dr. A was like, this is a waiting game. Like every week, she was like, our goal is week by week. Like every week.
Let's get more, just a little bit more time. Let's get the lungs
She's like,
developed.
every week that baby is in you is
gold.
Is a goal.
Yeah.
So I shockingly made it to 38 weeks.
I know.
Wow.
Yeah, and we induced at 38 weeks.
Wow.
Yeah.
Okay, and then the delivery, easy, great.
I had a fantastic delivery. Dr. A's the best. She's like a football coach in there. I was like, let's do this.
She's amazing. This girl does not complain, by the way. What she went through, it was really traumatic. 6 weeks she was having contractions.
That's crazy. Yeah.
And you don't know, are you going to have a baby today? Are you not going to have it? It would go away. We had her on medication to stop it. And then at some point we just let it be.
Okay.
But it was a long 6 weeks for you, I think.
Yeah, it was emotionally draining.
Yeah.
Just because it was so up in the air.
She's like, can we get this baby out?
Yeah. Finally, after 3 weeks of contractions, I was like, hey, is there anything
Those
we can
lungs are
do?
developed.
I was like, is there anything we can do for this? She's like, nope. She's like, love you. But yeah, it was intense. I gave birth and I was like, wow, I really did that. I did 6 weeks or however many weeks of contractions. And I have my beautiful daughter. I'm healthy. I'm safe. She's healthy. She's safe. Like that, I did it. Goal. And then I went home. I stayed in the hospital for 2 days. I went home and I blew up like a balloon. Quite literally, just swelled. Like,
Why would that happen?
She'll tell you.
Okay.
I thank God Dr. A is so caring and on top of it. I was texted her my symptoms again. I'm like, I'm really tired. I really don't feel good. I'm really swollen.
I don't feel good is the secret. If
Yeah.
you don't feel good, something's wrong.
Yeah, I felt very ill. And I also felt like when you're in the room with people talking and you're just not home. It was that constant feeling of nothing's home. I'm having conversations, but nothing's home. So she sent over her wonderful nurse, and my blood pressure was 165 over 103, which is like,
It's postpartum preeclampsia.
yeah. So the hardest thing I ever had to do, I think literally, was leave my daughter 2 days postpartum. My poor husband was like, I have to get you to the hospital because Dr. A's saying it's just not safe. Like, it's not safe that you're home. So I spent 24 hours in the hospital, and it was really, really, really hard.
Well, I thought preeclampsia happened when you were pregnant.
Very good point. Yes, towards the end of pregnancy, but so it can happen anytime after 20 weeks. Most commonly, it happens around the time of delivery, but you're at risk for up to 6 weeks postpartum, which is what people don't know.
I've never even heard of that. So I'm so happy that you're talking about this.
But I
What
will
is
tell you,
preeclampsia?
so we don't know what causes it, but what happens is your blood pressure goes up. And as that blood pressure goes up, it could be during pregnancy, it could be up to 6 weeks postpartum, and it can put you at risk for seizures. So it's a very, very dangerous condition. If you completely ignore it, you can have strokes from it. So as soon as, and I will say this on this podcast, sometimes patients don't have headaches or visual changes or right upper quadrant pain or dizziness. They might not have any of it, but the one thing they always tell you is, doctor, I don't feel good. That's why it's so important to listen to patients. And that's why we started this podcast, because as women, we always get dismissed, right?
Right.
When we say we don't feel well, people
are
are like, well, you had a baby, right?
Totally.
I would have said, well, Sophia, you just had a baby. It's okay. You're exhausted.
Totally.
It's different. Not feeling well is very different than being exhausted. They're two different things.
Yeah. And I think I could notice. I felt that. I was like, because I kept checking in with myself. Okay, you just had a baby. Stop complaining. This is normal. And then I was like, no.
Something's wrong.
Something's wrong. I don't feel good. This is bad.
That's incredible.
I have to tell you a story with her. Can I? She was, every time I walked in, she was on her cell phone in the hospital watching the baby. I'm like, don't you have a nanny? She's like, I'm watching the nanny too.
I used to do that with my baby nurse.
It's true.
In the middle of the night, I would like watch the monitor with I'd hear the baby, and then I'd watch the baby nurse would come, and I'm like, my husband was like, why are we paying a baby nurse if you're watching the baby nurse?
My horrible confession is I still do it to this day.
It's amazing.
Good for you.
All night. It's right there. next to
what
my bed.
makes you the most amazing mom.
I love you.
I mean, I can't even imagine how much love this child. Who gave you love growing up? Where did you get so much love
my
growing
mom
up?
is
The most loving?
the most loving, and my dad always talks about love and how love can change someone's life, and how to spread love. So I think that's it. I think the combination of receiving so much love and talking about how love can impact someone's life has just motivated me to spread love, especially because when I receive love from someone that maybe someone I don't even really know that well, it brightens my day.
You came home from the hospital. Then has it been, I mean, that was not long ago. I mean, that just really happened.
Yeah.
So has it been easy to, get back into to where you were? Like, how's that been?
I was on 6 to 8 weeks of medication, blood pressure medication, and that blood pressure medication really just takes the life out of you. So I kind of felt like I had preeclampsia, that sick feeling, for like 6 to 8 weeks, which was really hard. And my mom guilt kicked in. I don't know why. From the second Eloise was born, I was like, I can't miss an awake time. I can't miss a moment. I don't want someone else taking care of my kid. That was another thing that we talked about in the hospital, was like, yes, I feel so blessed and fortunate to be able to have people help me and to be able to have support. But I also am not interested in someone raising my kid. I wouldn't have had a kid if I wasn't ready to take that on. So my mom guilt has been balancing those two things. Like, I've kind of looked at my support that I have as, okay, I'm a first-time mom. I really don't know what I'm doing. I'm figuring it all out as I go. And I'm going to use my support as my teachers.
Yeah.
So I do things, and they have taught me so much. Eloise is 3.5 months old. And some days I don't even have any. If I'm not working, or if I don't have anything, I'll be like, you don't need to come in today. I've gotten to a place at 3.5 months where I'm like, I can take care of my daughter by myself, and I'm confident in that.
Right.
So,
it's confidence.
Yeah.
It's getting the confidence to make sure that you're not going to break them.
Yeah, totally. And I have so much respect for the women that just have a baby and figure it out on their own. Because there's moments where I've broken down and cried because I'm like, oh my God, did I hurt her? Did I break her neck? And, I have someone there to be like, no, it's okay. She's okay. But do this way next time. So I have so much respect for moms. It's like becoming a mom has given me a new profound respect for mothers.
The toughest job on the planet.
It's really hard.
Being a stay-home mom, I think, is the hardest job on the planet.
I totally agree with you.
Does Elliot help?
He does. He is super dad, and he identifies as a girl dad in a major way.
Oh,
I know. Ever since I was 15 years old, she's like, let me tell you the kind of guy you need to be with. My husband.
I was so happy. I really wanted you to find someone good.
Yeah.
And he's so good.
How did you know with him? Like, what was different?
You know what? No one's asked me ever that question, shockingly enough. For me, with all my previous relationships, I always found myself changing to be the right person for that person. And with Elliot, I knew he was the one because I was just 100% myself, and he loved it. And he was like, I love you, and you're great how you are. And he just magnifies me as a person rather than trying to change me as a person. And same with him. Like, we're such big personalities, both of us, and we're just each other's cheerleaders. There's nothing about each other we want to change. We're just completely, authentically ourselves.
And he's a pure gentleman.
Yeah, I love it.
I actually told my daughters when you guys got married, I'm like, this is the kind of husband you should bring home, because you don't find it anymore. He's so lovely. He's so kind. He's so gentle. He's a true gentleman. That's the only way I would describe him as a gentleman. Wouldn't you?
Yeah, 100%.
You don't see that anymore. Not at his age.
I love that. Yeah. I mean, that's so rare to find. And I love what you just said. You make it, you have a partner, and you make each other better rather than trying to twist yourself into something else.
Yeah, and I think it came with age, realizing that that's what I wanted. Just because when I was younger, I was like, oh, I'll be this person, and this person will like me, and this will work. And then at the end of those relationships, I was like, phew, thank God. I'm like, thank God, I can just be myself. You know what I mean? So yeah, it's easy.
I tell people that too.
Yeah.
I'm like, it's not supposed to be hard.
Yeah.
If it's right, it's easy.
And I always use that word, and then I feel like I have to like back up the word because easy sounds just
But it
not
should
great,
be
but
easy.
it's just easy.
This
Can I
podcast-
tell one quick amazing story? Elliot knows only one doctor in my life, and it's Dr. A. So I had horrible food poisoning. We were together. We just moved in together. It was like 1 year into dating. And I was like, I'd been sick for like, I don't know, 10 hours. And I was becoming extremely dehydrated. And I was like, I need to go to the hospital. You need to call my doctor. I need to go. Like, I was like dry heaving.
Yes.
And he's like, okay, I'm calling your doctor. And I assumed he was calling like the family doctor, the internist, like someone. Next thing you know, speakerphone. Hello? Is everything okay? It's Dr. A. I'm like, you called my OB when I had the stomach flu? What's wrong with you? But it's so on brand because it was exactly who I needed to speak to. Yeah.
We're going to talk about PCOS, and you struggle with PCOS. Can we talk about how you were diagnosed, like when that happened? Like let's start at the beginning almost.
Yeah, so like I said, I've been seeing Dr. A since I was 15 years old. And as a teenager, I had really, really bad acne. My weight would fluctuate. And so finally I came to Dr. A and I was like, I only thought, as a kid, I was like, I'm going to go to the gyno, I'm going to get a pap smear, and I'm going to walk out. And I'm not going to talk about this is what's making me feel not great in my day-to-day life. Like, I didn't even know to go there with my OB. And Dr. A really took the time. She was like, how are you feeling? How's your skin? I've noticed your skin's breaking out. Asking me like all the appropriate questions, I guess, to diagnose PCOS. And I was like, yeah, my weight fluctuates. I feel very moody all the time. I was also a teenager, but I'm very moody all the time. And my skin's terrible. And I can't figure out why, which is when she did a bunch of tests. I think she checked my ovaries and she was like, oh, babe, you have PCOS. This all makes sense.
Except I didn't call her babe.
She didn't call me babe. I like to think she did, though.
But so you're a teenager. So teenagers have acne. Teenagers are moody. And teenagers aren't sometimes eating all the right things. And so how do you you just kind of...
It's different though. It's a combination of symptoms you look at. PCOS patients usually have irregular periods. They have elevated testosterone symptoms and they present differently. One person can have acne, the other one has hair loss. One person has facial hair, the other person has body acne. So you don't have to have all the symptoms, but some of them. Testosterone levels are usually in the higher range of normal or above normal. These patients tend to be moodier. They tend to be more anxious. And they usually have family history of insulin resistance, diabetes, overweight family members. And they do struggle with their weight. What it means is they might eat the same thing as everyone else. They exercise more than other people, but they can't maintain their weight. It's really frustrating. I have insulin resistance. I get that. So it can be very frustrating. And when you don't diagnose these girls early, and that's why I love this podcast, especially for teenagers. You've heard this from me many times. A lot of these young girls with eating disorder, what do you think their diagnosis is? PCOS. They go to the doctor, they have acne. What does the doctor say? Well, change your diet,
Right.
exercise more.
Right.
These patients come to me, they're like, the mom's like, she eats like 1,000 calories a day. She's exercising every single day. She can't lose weight. So guess what happens? You have mood disorder. You add weight gain to it. It equals, I would have an eating disorder. You can't get dismissed like this. They need someone to diagnose them correctly to fix their underlying condition. And her symptoms are very mild. A majority of patients have severe symptoms.
So how old were you at the time?
I was probably 16 when I was diagnosed.
So how do you treat a 16-year-old?
So you treat the symptoms.
Okay.
One of the most common, easiest way to fix it is by putting them on birth control pill. Birth control pills do a few things. Number one, they regulate the cycle. Some patients, a lot of PCOS patients sometimes have heavier periods. You put them on birth control, they get lighter periods. Birth control pills stimulate a sex hormone binding globulin in PCOS patients. Usually PCOS patients have lower levels of this protein in the blood. The job of this protein is, in simple terms, it grabs onto the free testosterone in your blood. By giving birth control pills to patients, you stimulate this protein that acts as a vacuum and grabs onto the free testosterone, lowers the testosterone, so the acne resolves, hair loss, facial hair, body hair, irregular periods, so their symptoms resolve. So I like putting younger girls on a low-dose birth control some PCOS patients have really, really bad anxiety or depression. Those patients, I might hesitate to use birth control because I don't want to make them more moody. But for her, acne was her concern, and she was young. So I think I started you on birth control.
Yeah, birth control and spironolactone.
Spironolactone, which is an anti-testosterone also.
You have PCOS for your entire life. So when you want to become pregnant, what happens?
So it depends. Like I said, her case is very mild. So let's say she would have tried for, I don't know, a year, because she's so young when she started trying. Let's say she came back to my office and said, Dr. A, I didn't get pregnant. What's going on? I would immediately put her on metformin and she would have gotten pregnant. But like I said, she's not a perfect example of PCOS because her symptoms are very well controlled. She eats very healthy. She exercises. She does everything else right that a PCOS patient needs, but most women are not like her.
And I think when you're which is, you started OV because like a teenager coming in doesn't want to be on these medications that have side effects for their whole life.
The problem with PCOS is patients don't get diagnosed, right? They don't get diagnosed. So the literature says 75% of women with PCOS, 75% are not diagnosed. I think that number is 90%, or maybe I have a skewed view because that's all I see in my office for the past, I don't know how many years. But I think 90% of these patients are not getting diagnosed. But even when they get diagnosed, they're not being treated correctly. Every single day, someone comes and says, well, my doctor says you probably have PCOS, but there's nothing I can do about it.
Oh, yes.
It's not true. These
what
poor
about
patients.
young girls or any woman for that fact who don't have access to such an amazing doctor like you? Like, what do you recommend them to do? Like, maybe they're watching this and they're like, oh, I have all those symptoms.
It's been my mission in life to create a platform where women can go on and find out whether or not they have a likelihood of having PCOS and have access to a supplement that can treat their symptoms without really needing a prescription. This is why I created OV.com, and I know it will have a huge impact for women not diagnosed or not correctly diagnosed with PCOS. How do we fix it? You were asking. So we treat symptoms of PCOS. The main cause of it is insulin resistance. So insulin resistance means your body cannot process that sugar well, right? So you want to decrease your carbohydrate intake. You don't want to eat as much sugar. Exercise is very important. If you go and walk around for 10 minutes after each meal, you can significantly reduce your blood sugar level. Exercise at least 4 to 6 times a week is very important for PCOS patients. But the problem is diet and exercise doesn't cut it for them, right? That's when you add the metformin because 75% of these patients really have weight issues. Now, I started using GLP-1s, these, like medications similar to Ozempic, you probably don't know this, about in 2014. Back then, if I had a PCOS, because like I said, PCOS patients can be really obese. And I started using Trulicity for them. And these patients were losing 40, 50, 70, 80 pounds. Game changer. That's why these medications are not new. I mean, I was using it for PCOS patients only. And then what I do, so if they're obese or if their BMI is 27 or more, I give them these shots. Right now, it's gotten so much better. We have Mounjaro, we have Zepbound, Wegovy, Ozempic. These medications work magic for PCOS patients who are really overweight. I drop their weight, but I also add metformin to be able to maintain that weight for them. And then for the past couple of years, I've worked with this amazing scientist. He created this powder for OV, and this powder basically is anti-inflammatory. Did you know that PCOS patients have a very high inflammatory markers?
Every time I get blood work, my inflammatory markers are high.
Right.
You're going to love this.
So it's anti-inflammatory. It can curb people's appetite. It does help with insulin resistance significantly. And its efficacy, which I'm in a clinical trial right now with patients, which is going to be a game changer. And I will make sure to send you those supplements.
The point of all of this is that we want women to, first of all, understand that they have PCOS. And second of all, be able to do something that you don't
require
have to
prescription.
Have a doctor. Yeah. You don't need a prescription. You don't need a doctor to tell you that you have. Yeah, that's the goal. It's just
so diet, exercise. This powder doesn't need prescription. But even beyond that, once you know you have something, you can be your own health advocate, right?
Totally.
So I would say if you have irregular periods, if you have elevated testosterone symptoms, acne, hair loss, facial hair, body hair, you don't have to have all of it. If you have mood disorder, if you're a moody person, if you're more anxious or you have a history of depression, if you're gaining weight and you can't really, it's really hard for you to lose your weight. If you've had a history of eating disorder, if you have fertility issues, you probably have PCOS that's not diagnosed. The problem with PCOS is most patients don't know this. You have to educate. She's my daughter, and I would like criticize her boyfriends. I would criticize.
She would.
I would.
She would. She would sit me down. She'd be like, really?
This is who you're with?
I did. I never forget.
this.
I'm like, Sophia, look at yourself in the mirror.
Yeah, she would. She would. That's why having a baby with you was the best. Because I was like, we did it. We did it.
So once she met Elliot, she came in. She's like, you're going to be really proud of me this time.
I go, this time I've done really, really well.
Yeah. And so anyways, I kept saying, get pregnant. But why? PCOS patients have tons of eggs, right? The problem is as they get older, especially past 30, the quality can go down faster than other patients. These are patients at 35, 38. They go to the doctor does an ultrasound. It's like, oh my God, you have so many eggs. Don't worry about it. You're going to not have any issues, but it's the quality that does get affected. So these are the important, that's why I want people to know this. Like if your egg count is off the chart, you probably have PCOS. That's one way we diagnose it.
Okay.
And I always say if men had a condition that was their top cause of infertility and they would get dismissed, 75% of them would never get diagnosed. Can you even imagine? No, they would have turned this world upside down.
Yes, 100%.
So your PCOS is something that, you'll just be maintaining for the rest of your life. And does it get better after menopause?
I mean, it's the insulin resistant part
so
of
it's
it
the
after
insulin
menopause,
resistant.
which I have too. I don't have
Okay.
PCOS, but I have insulin resistance. A lot of us walk around with insulin resistance. But PCOS patients have that secondary issue with the high testosterone that comes from the insulin resistance, or it could be autoimmune or inflammatory.
So you have this beautiful baby. How did you get to look like this right now?
You know what? I shockingly gained 70 pounds.
Can you believe
During my
that?
pregnancy.
Little Sophia?
I did.
Where did it go?
I'm just a tiny little 5'6". Oh, it went. It went. It wasn't cute. No, I'm kidding. I gained like a appropriate, I think, amount of weight, like my first and second trimester. And then the reason why we actually induced at 38 weeks was because I was having a bit of dodgy blood pressures. I gained a lot of weight in my third trimester. And she was just like, this is a little weird. Everyone was like, this is a little weird. We're going to induce you.
Yeah.
Something's not right. And sure enough, something was not right. So because of that, I think it just kind of, I lost 50 pounds within 3.5 weeks.
What?
Yeah.
But a lot of that was fluid retention
Yeah, and I
too.
think, and I don't think it was weight I gained.
Yeah, it
I
was
think
fluid.
it was just fluid. Because when I was in the hospital, they put me. Was it a magnesium drip? They put me on a magnesium drip for the preeclampsia. I lost 25 pounds in 48 hours in the hospital just from the magnesium drip, and I could feel it coming off. Because my husband was texting Dr. A when we first got to the hospital, being like, "I'm scared. Her foot is massive." And we touched it and there's still a hole in her foot. So it was like I could feel it falling off.
You look
So,
amazing,
I'd say
though.
so.
For
Thank
3
you.
months? Wow.
I'm finally really starting to feel myself again. like
You
working
exercise
out.
every day?
I'm exercising every day.
Bravo.
I'm trying.
And in terms of like our listeners, their favorite thing when we get somebody as incredible as you, they want to know just a couple of tips. So is there an exercise routine that you love? Is there a supplement you can't live without? Is there a book that changed your life? Is there give me 5 tips.
Okay, so for me, a lot of my friends were like, why don't you just like go on Ozempic and make it easy? And I was like, no. I can do it. It's very easy. I'm very determined. When I put my mind to something, I go for it. So the first month after my pregnancy, I was like, I'm just going to heal. I'm not going to put any effort into anything. I'm probably not even going to move. I'm just going to heal my body and take care of myself. So that's what I did. I ate really well. I ate a lot of like nurturing foods, a lot of just things that are good for the body, the soul. That's what I did my first month. Nothing, no weight loss was thought of. And then in the second month, I started walking. For me, it's all kind of cardio. So I started walking every day. I would walk morning and night. It was also like great for me to get Eloise out of the house. So that was my second month. And then in the third month, once I was cleared to exercise, I started doing Pilates. I'm just eating really healthy, to be honest with you. I'm not eating less. I'm not eating very little. I'm just eating very healthy foods.
And what would you, if you could tell, young women out there that are about to go through having a baby or have just had a baby, would you have any tips for them?
Yeah, I think for me, now looking back on my pregnancy, I miss it. I'm like, oh, I wish I would have enjoyed that moment. Instead, when I was pregnant, I was like 32 weeks, 33 weeks, 34 weeks. I never like enjoyed the moment. And then when my pregnancy was over, I was like, ugh, I miss that. I mean, it's such, how do I word this? It's such a intimate moment being able to share one space with your child that you'll never kind of get back again. Your kid comes out and then, oh God, I don't want to get emotional. Your kid comes out, I know. Oh. Your kid comes out and then you share your kid with everyone, which is magical, but that moment with your child is so special.
I think that what you just said is so true. So just that special time with them is...
That's such a good advice. It's so good because we always, especially in this country, you always want what's next, right? You have a baby, you're like, so when is she going to walk?
Yeah,
so when is she going to talk?
Totally.
When is she going to do this? When is she going to go to school? Where do I go? Where does she go to school? We never stop to enjoy the moment.
Yeah.
And what do you think is the most surprising thing about motherhood that you've found so far?
What was surprising was I figured it out. Like, it just takes time. You figure it out. I remember in the beginning, I was like, oh God, I'm not cut out for this. Is she safe? Am I doing things right? Am I ever going to figure this out? Am I ever going to feel confident? And I am so surprised, happily surprised, that at 3 months, I am so confident with my daughter. I know what I'm doing. I understand, because I actually, during my pregnancy, I had a girlfriend who just had her third. And I watched her with her baby. She was like, done.
Throw him on my back.
Asleep for 2 hours. See that kid in 2 hours, not a big deal. And my kid, I remember I was like, she's crying, she's screaming. I don't know what to do. You know what I mean? It's like the experience, the more you do it, the more confident you get with it. So I'm just surprised that I got it down at 3 months. I'm really happy about it because if you would have asked me 3 months ago, I would have been like,
I always tell her the biggest compliment I can give someone is that they're normal. But she's the most loving, normal human.
Oh, I love you guys so much.
No,
Thank
this
you
is
for
and for opening your heart and being
and for
and
educating
talking
people on
Oh,
PCOS,
yeah,
on motherhood.
I've actually never done a podcast before. This was my first podcast, and it was really exciting for me to come on here because I wanted to share and spread, obviously, awareness to such an important cause for women, especially young girls who, don't have access to such amazing healthcare. But I also never I've never felt pulled to do a podcast and talk about things that are personal with someone that I don't know, per se. So the opportunity to sit with you is, I would do anything for you.
I love you.
So I love you.
Thank you, Sophia.
Thank you guys for having me. This was fun.
Thank you for doing this. Your first podcast.
My first and probably my last. I'll mic drop it right here.
That was the most fantastic interview. She is exactly like you said. She is light and warm and amazing. But I want to repeat something that was said in this interview for all of our listeners. Trust yourself. If you don't feel well and you feel something is off during pregnancy and afterwards, let your doctor know.
And to any doctors listening, when our patients tell us they don't feel well, listen to them. They're almost always right.
Follow us on social media at SheMD Podcast to stay looped into all of our conversations on women's health. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.